Thank you so much. My name is Dr. Robin Armstrong, and I live in, excuse me, I live in just south of Houston in Friendswood, Texas. And so I flew up last night to come here, and I also, any of you Republicans in the room, I represent Texas on the Republican National Committee as well. I'm also a county commissioner in Galveston County, so I kind of have a broad experience and a lot of, just with healthcare, obviously. I own my own medical company as well. I'm a hospitalist, and so that means we do inpatient care in hospitals. So we go to about 8 different hospitals in that area, and we have 400 nursing home patients as well. So we've got a large hospital-based practice, large nursing home practice. There's about 28 physicians, NPs, and PAs. So we're quite a large group. It's the Armstrong Medical Group. And so we've got a lot of experience just across the spectrum taking care of folks. And so back in March of 2020, late March of 2020, actually, we were at one of our nursing homes. In our hospital practice, we had a lot of experience treating patients with COVID. And so everyone was using hydroxychloroquine, azithromycin, and zinc in the hospital, actually, but people were very sick, they were on ventilators and such, so it wasn't very helpful once you've gotten that ill. And so we had a large outbreak in one of our nursing facilities, and so we decided, I decided that why don't we use, this 3-drug regimen in the nursing facility? It just makes sense. It was just common sense. It wasn't anything, earth-shattering or earth-shaking or anything. It was very common, made sense. So we had about 86 patients that developed COVID, and so we treated them with that, and we lost one in the nursing home. Just one patient. We didn't send them to the hospital. We kept them there. We set up kind of a MASH unit in the nursing facility, and we did really well. And I was in contact with, the governor, Abbott, was calling me, how are they doing? How are they doing? Asking me how they're doing. I had gotten the medications from Lieutenant Governor Patrick, had helped me get the medications. He had known a state senator that did some work with the company that actually makes hydroxychloroquine, and so I got the medicines that way. And so we were able to procure this large amount of medicines, treated the patients, they did well. We were preparing to write a paper on that, but what ended up happening was we were attacked for that. And so it was the weirdest thing for me. I had been involved in politics for about 30 years prior to that, so I was used to being attacked for my political beliefs. And so, but I didn't think I would get attacked for just treating patients, when the outcome was good. And so that's exactly what happened. And so so that's just kind of a little bit about my background. The medical board investigations went on for 9 months. We were attacked by that body, and eventually they just dismissed everything because of my political connections probably, but it was just a big fight and a big ordeal. And so we got through it. I never took the vaccine. We took care of our patients. Our patients did well. We didn't have the nursing home experience that New York City had. So that's just a little bit about my background. It has nothing to do with the talk that I'm going to give today, but I'll talk about some medical freedom stuff. But we're going to talk about enhanced clinical strategies for geriatric care. So we take care of elderly patients. I think during that time, we really failed our geriatric patients. We just failed them so badly. And I think we lost so many people that we did not have to lose. Next slide. Oh boy, I cannot read that at all. Let me see. Oh, it's bigger up here. So I will have to do that. I have a little thing down back here. And so we're going to use agenda. We're going to use evidence-based approaches to prevent, diagnose, and manage common medical problems, promote a quality of life for our elderly folks, promote functional independence, which is extremely important, address ethical and systemic challenges in elder care, and recognize ethical dilemmas and resource limitations, and recognize public policy barriers. So this is our agenda. Oh, thank you very much. And so the 5 M's, and so geriatric approach to medicine and take care of patients, multi-complexity. Our geriatric patients are very, very complex, and so they have a lot of medical problems. So you really have to have a holistic view of medicine when you're taking care of them. It's not just about, what medication I'm going to prescribe for them. Very important. We talk about the mind, mobility, medications, and what matters most. We'll come back to those later. Next slide. There are about 57.8 million adults age 65 plus in the US. Wait a minute, there was a point that was there. Yeah, there was a point there. I left something out on that part at the top. So there are about 88,988 people age 100 and older in 2022, more than double the number in 1980. So yeah, actually those numbers are about accurate. 57.8 million adults age 65 and over in 2022, about 31.9 women and 25.9 million men. Among adults age 65 and older in 2023, 59% live with their spouse, while roughly 28% lived alone. And I'll tell you, there's one thing I say to my patients when I go into the hospital. I always say, you know, the wife is there and the husband is there and the husband's the patient. And so I'll go and I'll start talking to the wife immediately. I'm like, I'm not gonna get a good story from the husband. How many of you husbands know that out there? I never get a good story from the husband. So I go talk to the wife. And I say to the wife, oftentimes I say, you know, I say to the husband, actually, I say, you know, you call it nagging, and I call it extending your lifespan, because women who nag their husbands, and it's actually been shown, you know, there's evidence that shows that men who are married actually live a lot longer than men who are not married. So the health of older adults, there's chronic diseases that we all know about, cardiovascular disease, high blood pressure, heart disease, hardening of the arteries, and respiratory illnesses like chronic obstructive pulmonary disease. You know, as you get older, your lung function declines a little bit. So certainly if you smoke, that's gonna make that slope a little greater, that decline a little faster. So also asthma. So we have a lot of folks coming to the hospital. Those two right there account for many, many hospitalizations. Cancer, increased risk with age. Certainly you're more likely to have DNA mutations and such, and so these malignancies generally are more common as you get older. Type 2 diabetes and insulin resistance, common condition in older adults as well. As you gain weight, you're going to tend to develop type 2 diabetes. Musculoskeletal issues, and so I guess I wouldn't count myself as elderly right now, but I certainly am getting older, so I'm feeling some of that arthritis a little bit. So degenerative joint conditions cause pain, and reduced mobility is very, very common, and osteoporosis, and so, which is very common as well. Next slide. So in cognitive and mental health conditions, and these are significant in the elderly population. You got dementia and Alzheimer's disease, progressive neurodegenerative disorders that lead to memory loss and decline. And these add to a lot of problems with the medical issues as well, which we'll get to a little bit later. Depression, a serious mood disorder that can be triggered by life changes and health challenges as well. We saw a lot of depression during COVID. I can tell you horrible stories, and I'll get to some of those later, about how some of the things that our patients would say during that time. It was a very, very sad situation. Next slide. There's sensory impairments. You have vision problems, can result from aging or conditions like diabetes. Diabetes is a very common cause of blindness, probably the most common cause of blindness. And then there's hearing impairment due to changes in nerve cells. And so all of these medical problems sort of come together to make it a lot more complicated to manage elderly folks, and so certainly the mind and the memory problems play a significant part in that as well. Next slide. Metabolic and nutritional problems. Malnutrition is a common problem. Can be due to difficulty swallowing from a stroke, decreased appetite. You know, I tell folks all the time. You know, I know they have daughters who are trying to stuff food in their parents' mouths. I'm like, okay, they're probably not hungry because they're not as active. And so when you think about movement and mobility, which we're gonna get to a little bit later, that's extremely important, because the more you're moving, the more you're gonna eat, and you're gonna wanna eat, and so malnutrition is a big problem we see in the elderly. Functional and mobility issues. Falls is a major cause of serious injury in the elderly population. That is a focus in the nursing home community, because falls is a significant problem. If you have elderly folks who are getting fractures, and you know your mortality rate if you fracture a hip as a woman is pretty high. The 6-month mortality is very high. 5-year mortality is very high. And for a male, it's even higher. And so we try to prevent folks from falling. Incontinence is a big problem as well. Often, a lot of times, the incontinence leads to falls. And so it's a very debilitating issue in the elderly. Next slide. So how do we give the best care to our elderly loved ones and patients? We honor them. I think this is something that's lost among a lot of folks. And so I think this is really important. And this is where I think we fail a lot. And I'll get to that at the very last slide in the end. I will exhort you in a way. And so at the very last slide, but we honor them. Exodus 20:12 says, honor your father and mother that your days will be long on the earth. It's the only scripture, only commandment that has a promise attached to it, that your days might be long on the earth. Honor your father and mother. And what does honor mean? Honor means to care for, to take care of, to love, to respect. I was listening to a Charlie. Oh gosh, you have a time stamp here. Somebody give me a time because I am just rambling on here. So Charlie Kirk was he was talking to a college student, and he said to them, I knew Charlie and worked with TPUSA very closely, but he said to someone, they said, well, my dad, is very, very liberal, and my mom is very conservative. How do I have a relationship with my dad? And he said, you honor your father. Even though you disagree with him, you honor him. And so, and I thought that was such a good thing to say. You respect him, you have a relationship with him, you don't talk about things you disagree with him, you honor him and you respect him. Even though you disagree with him, even though he may be wrong, you still honor them. Leviticus 19:32 says, you shall rise up before the gray-headed and honor the presence of the old man and the old woman, and you shall fear God. Fear your God, I am the Lord. I'll tell you, we should honor the presence of our elderly. And I think our society has that backwards. We tend to really focus on the youth, and what a crazy way to think. We're focusing on someone who has no experience and no sense a lot of times. We should honor our elderly. Gray hairs. Everyone's trying to be young now. I think it should be just the opposite. I think we should honor and value our elderly. And I'm going to talk a lot more about that later. Next slide. So this is a quote by Benjamin Rush, looking back to COVID 2020. Why did we go wrong? Benjamin Rush was one of our founding fathers. I don't know if y'all knew that. He was in the 1800s. He was battling over what kind of constitution we were going to have. And so this is a quote by him, and this is back in the late 1700s when he said this. And this guy was really smart. It says, unless we put medical freedom into the Constitution, the time will come when medicine will organize an undercover dictatorship. Hadn't we seen that? I'll tell you, there's probably more to come. To restrict the art of healing to one class of men and to deny equal privilege to others will be to constitute the Bastille of medical science. All such laws are un-American and despotic and have no place in a republic. The Constitution of this republic should make special privilege for medical freedom as well as religious freedom. He thought medical freedom was as important to put in the Constitution as religious freedom. That guy was pretty smart. In the late 1700s, he understood something that we are understanding more and more today that I did not understand before COVID, but I understand a whole lot more after COVID. Medical personnel must be free to practice evidence-based medicine to properly care for our patients and to put them in the best position to be successful medically. Next slide. Uh-oh. I should have fired up the computer. Oh, there we go. During COVID, we isolated our elderly, and we justified it by saying we're protecting them. Today, we isolate our elderly by placing them in facilities and not being active and present in their lives, not honoring them. Examples of this during the COVID lockdowns, I'll tell you, I had many patients actually, that were locked in their room, and they were moved over to COVID hallways where they were isolated. So they were not in their regular room. Their families were not allowed to come in. We're not allowed to see them. We're not allowed to interact with them. And I had a lady just say one time, she said, Dr. Armstrong, I just want to go back to my old room. I just want to see my family, as she's crying. I'm like, what a simple request that we were not doing because we were protecting them from this virus. That killed a lot of people, sent a lot of folks into depression, which we're going to talk about a little bit later, and how that adversely affects the elderly. Had a significant impact on quality of life for the elderly at that time. It was a crime to do that. I'll tell you, it was a crime. And I'll tell you, and I really fought for the elderly during that time, but I don't think I fought enough. I mean, I think probably if they tried to do that again, I'd probably go to jail, because I just saw the negative impact of how that was. I'd probably be right next to you, sir, in federal prison, because that cannot happen again. How we treated our elderly is, we dishonored them, and we killed a lot of them that should not be dead today. Can lead to clinical depression, which causes a downward spiral. Next slide. Major depression. Between 1% and 5% of older adults living in our community experience major depression, which is extremely debilitating. Now, that's major depression. And this is part of the mind, the 5 M's. As of 2023, 13.2% of adults 65 and over experience significant clinical symptoms of depression. And so depression is a major, major problem in our elderly today. It's a very high prevalence in nursing facilities, very high prevalence in hospitals. We see it a lot more. And so, folks just give up. Whenever I'm coming to a room, I try to be happy and lighthearted, because I think they deserve that, because they're sick, not feeling well. And then oftentimes, they're lonely as well. Next slide. Risk factors for the depression: chronic health conditions, which all of them have, most of them have. There's a functional decline as well. Chronic pain is another problem. Loneliness and isolation, bereavement, elder abuse, and caregiver stress. And I'll tell you, these are issues that we need to be looking at with our elderly folks, because these are so important to make sure you extend their life. Functional decline, we'll talk about a little bit later. I say all the time that movement is life. And so when you go into the hospital, if anybody who has an elderly person, loved one, mother, father, brother, whatever, yourself, when you go into the hospital, demand a physical therapy consult on day 1. That is so important. Movement is life. If you stop moving, I'll tell you, when I go to sleep at night, and I'm not elderly yet, I'm getting there fast, but I go to sleep at night, when I wake up in the morning, I'm a little stiff. Think about someone who's in their late 70s or 80s and how stiff they are when they wake up in the morning. Think about being in bed for 2 days. I mean, they can barely walk. Next slide. Keeping the elderly, it's absolutely crucial that we keep them keep them active, keep them mobile, because it affects their physical health, mental well-being, and independence as well. Reduces chronic health conditions such as heart disease and diabetes and stroke. Also helps with certain types of cancer, strengthens the body's cardiovascular fitness, strengthens the bones. The people who live a long time, the people who are living into their 90s, they're very active. My aunt is 96 years old, and she actually was at our house recently. She lives in Baltimore, Maryland. She was actually at our house recently, and she does so well because she is active and engaged. And so she's just the coolest lady. Her mind is sharp and strong. She can't hear it all, but you have to really yell at her, but man, she is just sharp. And so she kind of tripped a little bit, and she fell, and she says, I'll tell you, I hadn't fallen in years. She said, I'm just like a cat. She says, I don't fall at all. It's like, my aunt's really cute. So she's really sharp, and she's active because she's well because she's so active. Increases balances and falls, staying active, routine movement and stretching, physical occupational therapy consult for all elderly patients in the hospital. Movement is life. Remember that. Movement is life. It also improved the immediate benefits of exercise program: improve sleep, less anxiety, it lowers your blood pressure. I don't know, just as a society, I think we really minimize the importance of sleep in all of our lives. It is so important to get a good night's sleep for everybody, not just the elderly, especially the elderly, but guys, you need to get at least 6 hours of sleep. You need to do that. You'll be healthier. You'll feel better if you do. A long-term benefit, you'll live longer if you do. How about that? So long-term benefits of brain health, reduces incidence of depression and dementia. Heart health lowers cardiovascular disease risk. Cancer prevention, it actually lowers the risk of 8 different cancers. You see them listed there. That's pretty amazing. So, Exercise to prevent all this stuff. Healthy weight, lose weight. Independent living helps you stay independent longer, like my 96-year-old aunt. Bone strength helps prevent serious injuries with falls, improves balance and coordination. Extremely important. Next slide. During COVID, we did just the opposite. We did just the opposite. Of everything we should have done, we did the opposite. We isolated our elderly, which affected their mind, made them depressed, clinically depressed, and then we immobilized them. We kept them in the same room. So it's a huge missed opportunity. What we should have been doing is we should have been saying, open up all the parks, open up all the beaches, let everybody go outside, let everybody go outside so their vitamin D levels will go up. Make sure we get them their exercise so they're not as fat. You know what I mean? I mean, it's so important. Diabetes type 2 is a risk factor for that is obesity. You lose weight and you go outside and exercise, you're just gonna be healthier. And you actually, you would have reduced your risk of dying from COVID had you done that as well. We did just the opposite, horrible. Medications, polypharmacy, this is like the 4th M. Polypharmacy is a serious medical condition. Drug overdose deaths are increasing dramatically in the elderly, not because of suicide, but because of just polypharmacy. Next slide. Strategies to address polypharmacy in the elderly. This is an important issue, and so it is, you just have to have a comprehensive medication review, just de-prescribing medications, withdraw meds as much as you can. I think that's really important. My 96-year-old aunt doesn't take very many medications as well. And so, she's doing well. Utilize evidence-based tools like Beer's criteria for you physicians. That's a way that you can cut out inappropriate medications that patients are on. Promote family education and involvement. Medications is a big issue. Make sure if you have an elderly loved one, you have a good list of medications that they're taking. Make sure you look through their medicine cabinet because there will be medicines that one doctor discontinues and they'll be taking them both, which will make them fall and get dizzy and fall and break a hip. And so make sure you go through their medicine cabinet, have a good list, throw out the medications that were discontinued. Extremely important. And so go through that with your doctor and go through that with your elderly loved one as well. Adopt non-pharmacologic approaches as well. Next slide. And COVID, obviously, healthcare industry prescribed medications that were not necessary and in many cases harmful to the elderly. Very unfortunate. My mom asked me if she should take Paxlovid. I'm like, Lord, why? No, don't take it, and she went against my judgment. My mom's 80 and she's actually very active and healthy right now too. But she went against my recommendation. She got the first COVID shot. She got so sick, she never took another one again. So she's like, I shouldn't have done that. I should have listened to you, and so what matters most to the patient, make sure you get an advanced directive and living will, financial legal advice, will and testament. All this is important. DNR, DNI, do not resuscitate, do not intubate. That's all really important. How aggressive they want to be medically. That's important stuff to figure out ahead of time. You never want to make those decisions in a crisis situation. Designate a power of attorney who can make decisions for them as they get older as well. Next slide. Make sure I'm not backing off the stage. That'd be really embarrassing to back up and fall. I've seen that happen before, so I look every time you see that. Next slide. What matters most to the patient? Empower the elderly patient to make decisions ahead of time, and they will engage their health care more actively. Patients I love engineers for patients. Any engineers in here? You guys are fantastic patients because you guys usually have very particular lists. You have lists of medical problems and medications you take and very organized. I love that because they're very much engaged in their health care. And we want to have people engaged in their health care. I love patients to ask me questions. I think it's fantastic. If I don't know the answer, I'll tell them I don't know, but I love that because they're engaged in their health care. Never a good plan to wait until there's a health care crisis. And healthcare providers must direct these conversations because no one likes to talk about that stuff, including me. My wife directs that conversation for me. Next slide. So what are the most, some barriers and ethical issues? Next slide. It's a lack of interest. I think we have a youth-focused society in large part. So there's a lack of interest a lot of times in our elderly, which I think is shameful. I have a little saying that I say, is that I think that you judge a society based on how they treat their very young and how they treat their very old. And so I think you judge a society based on that. And so I believe we have to treat our young better, and we have to treat our old better. Our young meaning our babies, our in utero babies in particular. Lack of interest, lack of resources in prevention, Medicare costs, Medicare, Medicaid costs. Government trying to restrict acute care costs is an ethical issue that you're going to come into contact with. Post-acute placement costs, where do they go after they get out of the hospital? They've had some sort of big medical issue. That's a big, big issue now where they're trying to save money. And so they're restricting them from going places like rehab, and they're pushing them into nursing homes or skilled nursings, or trying to force them to go home with home health. Home health costs, hospice care. Some states obviously have euthanasia, which is absolutely immoral, and should be fought against at all costs. But I'll tell you, this is a post-acute care costs, where they go after the hospitalization. That's a big issue. It's an ethical issue. I don't have time to go into it today, but the government's trying to save a lot of money in that space, and so you're going to deal with that if you have an elderly loved one. Next slide. In closing, the most ideal situation for every elderly patient as they become incapacitated is to be cared for by immediate family and extended family, and then to die with those family members close by. That is the ideal situation. That is what we want. The irony is, it's best for the patient, the sacrifice is best for the family, and it's best for actually decreasing healthcare costs as well for our system. So that is the only thing that is better for everyone. It is a huge sacrifice for family. I get it. A lot of families can't do that. It's difficult, but I think that we need to get to the point where we are sacrificing for our elderly loved ones. It's great teaching for our kids. And I think it's just a great, it's huge, hugely important. So that's it. Thank you very much. I appreciate you all being here.